Welcome this evening to the good, the bad, and the ugly, the COVID-19 vaccine uptake among harm reduction agencies. This is a really exciting and current topic that we all need to talk about. You can go ahead and advance the slide for me, Naomi. Who we are. So the New York State Harm Reduction Association, aside from me, who shows up late and doesn't turn my mic on, our mission is to introduce and promote harm reduction in New York State as a scientifically based treatment appropriate for substance use disorder, as well as a lifestyle approach for people who use substances. Our vision is harm reduction will be established as the preeminent scientifically based treatment modality for substance use disorder and the appropriate response to people who use drugs. Our activities are to provide members with access to cutting-edge clinical and peer trainings rooted in harm reduction, and we just hosted a very successful harm reduction conference. And we advocate for policies that make harm reduction the preeminent treatment modality across New York, and we collaborate with partners working at the intersection of race, gender, and class to end the opioid epidemic. And you can advance the next slide. And we hope that you'll join us. We are looking to expand our membership all the time. As a member of the New York State Harm Reduction Association, you can help further expand harm reduction as the preeminent practice to uplift our communities. Membership benefits include strengthening the collective voice and the leverage of the harm reduction movement. You gain access to high quality trainings for staff at all levels, from clinical practitioners to peers. And you receive special discounted rates for educational opportunities. Again, as an example, our recent harm reduction conference. And we have worked very hard to make an affordable range of membership options. And so it's based on a sliding scale that considers the type of member and their budget. Annual dues for organizations range from $250 a year to $2,000 a year. And for individuals, they range from $200 a year for professionals to a consumer rate at $10 for the consumer per year. If you would like to join us, our email is listed at the bottom, and certainly you've been receiving emails from us as well. And you can join or visit our website as well to find out more about how to join us as a member at nyshra.org, New York State Harm Reduction Association.org. And so without further ado, I'm so excited for tonight's panelists, and I'm going to hand this off to our moderators to introduce them to you. Our friend Alessandra Miller from ACR Health, and Robert Suarez from the Urban Survivors Union. I hope you enjoyed tonight's presentation.
Good evening, everyone. I'm so excited to be here and with you all. You all are awesome, and we have some pretty fantastic and just really smart panelists today. So I'm so excited for you to get to know them and for them to introduce themselves in a second. But my name is Alessandra Miller. I'm the Director of Drug User Health with ACR Health. It is a harm reduction organization located, we service, our service area includes most of central New York and northern New York. So it's a little cold up here, but you know, just like everyone else, we're kind of getting through this. So like I said, I'm so excited to be here. You know, we all are experiencing some, you know, difficulties and some, you know, adjustments with this virtual setting. So I encourage you to act as if we're all in person and we're just, you know, all together. And a way that you can do that and interact with each other is please utilize the chats. You know, talk to each other, get to know each other. Also, the Q&A, please feel free to submit any questions throughout that time. That way we feel like we're all together and not in this kind of virtual world. So thank you so much. And I am going to pass it off to my co-moderator, Robert, who's awesome, absolutely amazing.
Wow, thank you, Alexandra. Good evening, everyone. My name is Robert Suarez, and I am honored to be here moderating this panel with my co-moderator, Alexandra. And We hope to be able to unpack a few things that have to do with the good, the bad, the ugly, and COVID, and the vaccines that are coming along with COVID. Two that are out and one that's on its way. So many things to discuss, so many issues around it, so many unknowns. We're going to try our best to pick through it and see what we can find out. I sit on the board of NYCHA, the New York State Harm Reduction Association. I also sit on the board of the Urban Survivors Union, and I am the National Coordinator for the Urban Survivors Union, along with a few other things that I do. But right now, I am just really, really excited to be here and to be joined by this awesome panel. And without any further ado, let's just keep this thing moving. Once again, I just want to remind everyone, please, please, please join us in the chat. We'd love to hear from you. If you have any questions, make sure that you log them in there so that we can try and take as many questions as we possibly can. And let's keep this thing going. Alexandra.
All right, so let's have our panelists introduce themselves. Let's start it off with Dr. Artie. Go ahead.
Hi, good evening, everyone. It's a pleasure to be here. I'm excited to be here and, of course, happy to be here to provide whatever information that I can. I happen to be the Chief Psychiatric Officer for Housing Works, and I'm a psychiatrist. So whatever psychiatrist can contribute to this conversation, I would be more than happy to do so. I also have a bit of medical knowledge that, if needs be, I can share with you. So I'm happy to be here this evening to participate.
Thanks so much, Dr. Artie. Let's keep it rolling. Riley, can you introduce yourself?
Yes, my name is Riley Glasgow. I'm happy to be here this evening. I work for Alliance for Positive Change at the Lower East Side Harm Reduction Center. I am the Associate Director of Prevention, and I've been working in this field for over 10 years.
Thanks so much, Riley. And last but absolutely not least, Joanne, go ahead.
Thank you. Good evening, everyone. So glad to join you, and glad to share the screens with my colleagues as we have the opportunity to talk about the COVID response. I am the director for the AIDS Institute at the New York State Department of Health, and I've also had the opportunity to work with a lot of people across the state on different initiatives in our response. So looking forward to answering whatever questions I can and to learning. Thank you.
Awesome. So let's just keep this thing moving, because I know that people have a lot of questions, and I'm sure our panelists are eager and waiting to get that answer in a lot of them. So let's just start off with the first question. All right, and this goes to all of our panelists. Are people eager or hesitant to get the vaccine? What have you heard on the ground, if anything? And that goes out to either one of them.
Okay, I do work on the front lines, and the spectrum goes from one end to the other. You have some people that's very eager to get it. Then you have some people you would have to chase them down and tie them down for them to get it. Okay, we have a very large spectrum. I do believe that looking at the science and people starting to pay attention to the different information that's coming out, more and more people are starting to buy into possibly going to get the vaccine. They're starting to ask us where can they get it from and asking us for the links. But you got some people they're not really want to hear it. I think some of people are looking at us as guinea pigs and seeing if we grow an extra head or anything before they go ahead and get the vaccine. You know, people asking me every day, how you feel? Are you all right? I get very weird, strange phone calls.
You know, I'm not surprised that people would be hesitant to the vaccine, especially in our communities and communities of brown and Black folks, to be honest with you. And there's a reason why, and there's a valid reason why. I mean, there's a history of, if you look at medical history in the United States, this is a history of experimentation upon people of color from the very beginning. quite frankly, there have been stereotypes about people of color from the very beginning in terms of folks of color can tolerate pain better than others. Our cranium are small, and so it prevents the brain to grow, so we're not as intelligent as others. And because of such stereotypes, there have been experimentation on people of color for many years now. Everybody talks about the Tuskegee experiment that lasted for for 40 years. But if that was the only reason, you may say, okay, you know what? Folks of color should be able to trust something. But there's a long history of this, from gynecological experimentation to
military,
to military and so forth. So I don't blame folks, but nonetheless, it's up to us as leaders in the community to provide people with the knowledge that could help save their lives, because it's I would say it's a damn shame that something like this, such as vaccine, has come along that can save lives, and people are being hesitant and waiting to see if, let's say, Mr. Suarez is gonna, grow wings or something, or if I'm gonna, be able to levitate. It's up to us to provide this type of education, and I think with forums like this, it's helpful. But again, I don't blame the concerns, but nonetheless, we have to acknowledge it, validate it, and nonetheless still deal with it and press into it and provide the information that could save lives.
Mm-hmm. And so I can say I absolutely agree with both what my colleagues have said. Certainly, if you're looking at the media, you see all the different articles about the challenges of getting an appointment in that, and that's because so many individuals are seeking to be vaccinated. At the same time, for those individuals who are taking a pause and looking to ask questions, I think what's key here, and certainly, when you think about this from a harm reduction conversation, what's key in harm reduction? It's about providing information to individuals so that individuals can make informed decisions for themselves and their health care. So I also think it's really important to understand that while someone may not be ready to accept a vaccination today, that doesn't mean that down the road the individual won't be ready. So I will acknowledge I'm a little bit put off when I hear a lot of the term vaccination hesitancy. I get it, I understand it, and we have to find simple ways in which to describe things. But I also think that for some people, it is about taking the time to understand exactly what it is they're accepting. So I'll stop there.
And let me just add, since this is a novel or new vaccine, because it's working with mRNA of the virus, and it's just kind of different. And so it's up to us to really provide that scientific information to just make it into layman's terms as far as explaining how is this vaccine different from other vaccines. Because we have, I think, 4 other vaccines or 5 other vaccines that are coming out, including the Johnson & Johnson one, and then they have different mechanisms of action. So I think explaining how they work will be helpful.
Mm-hmm. Mm-hmm. What I do want to acknowledge, though, and so this is part of understanding what the impact is across our state. What the estimate is that we need 75 to 85% of individuals in New York State to be vaccinated in order for us to see the anticipated impact that vaccination can allow us. I don't say that in an effort to say to someone, well, we need you to do this in order to achieve that. But I do think it's important to understand, why is there so much public service announcement? Why are there so many different articles and such a prioritized focus around vaccination? It's because if you look at the last 10 months, we went from a place of yes, prevention, certainly, and then we came to a place of testing. And now we're at a place of vaccination. And so I think that we have built up to the moment that we're in. We still have more to learn. But what we do know, we try to present to the communities in a way that helps build understanding of why you're seeing certain things. But I absolutely want to echo, though, Dr. Arty's points as it relates to Black and Brown communities and other BIPOC communities as well. And understanding the history there and the reservation around, what is it that's being offered to us? What is the benefit? And also what are the perhaps unintended challenges that individuals may face. And those are fair conversations and questions to ask.
And being a man of color, I was totally against it at the beginning. And yes, it's because, you know, I was in the military. I've been guinea pigged a couple of times and found out later that A, B, and C causes D, E, and F. And I'm like, well, you didn't tell me that, you know, so forth and so on. The history books is full of examples of us being marginalized and used to test whatever medical instruments or whatever. And but what happened with me is it hit home. Family members, daughters, sons, started to get it until one of my family members had to be incubated. And they're like my little mini me. So and they like 20 years my junior. And I'm like, maybe it behooves me to go ahead and look into this a little bit better, because you never know. And you let people know that, you know, you can change your mind. You need to do your research, what information you need to know, really pay attention, and go with your gut.
Mhm.
Wow, right.
And for the last year, this hasn't gone nowhere. So we need to prepare, because life has changed in the last year.
Thank you so much for sharing that, because I really think that that really hits home for a lot of people. And I think that that really leads into our next question really well. You know, when we talk about, you know, what are the side effects of this vaccine, and, you know, how can we use a harm reduction approach, right? Because that's what we're interested in, to discuss the pros and cons of getting the vaccine. So I think this question I'm going to pose to Dr. Artie first, to kind of get, what are the side effects? What have you heard? You know, what's going on?
Sorry, I keep forgetting to unmute myself. I'm gonna have to remember that. You know, Alessandra, one thing we have to differentiate is side effects from what we call neurogenicity, which is essentially naturally what would happen, or what does happen when you take a vaccine, such as having a high fever. I have to, in full transparency, my second dose of the vaccine, the Moderna vaccine, had a very high fever. The next day I felt bad, body aches, and so forth. Did I consider that a side effect? No. All those symptoms were normal effects of having taken this vaccine. This is expected. This is documented. And so people should not be worried about that. As a matter of fact, I have to say that the vaccines are safe. Of course, there was, I think in the United Kingdom, when it first came out, there was a report of an allergic reaction. And I think also someplace out, I think it was in Alaska. And clearly there were staff persons there who would deal with any what we call anaphylactic type of reactions, okay? But the symptoms having to do with a sore arm, having fever, the body aches, the feeling of exhaustion the next day after these vaccines, especially after the second dose of the Moderna, all of that is appropriate reactogenicity. It's appropriate, we should expect that. And other safeguards that are placed with these vaccines is that when a person takes the vaccine, they are given 15 to a half hour just for a clinician to observe them, to make sure that there aren't any immediate anaphylactic type of reactions that we would need to respond to. That should happen quickly, immediately, okay? And so what I have to say is that the vaccines are safe. I thought I would have taken the vaccines to get some superpowers, or become like a Captain America super soldier, but I'm still tiny. And I'm still having water pistols as arms as opposed to machine guns. So none of that happened. And there has not been one report of any death or anything of that nature, or someone having to go to the hospital to be intubated or any of that nature. Okay, that's my response to that question.
So when you hear people say, oh, I had a fever and I had chills and I had that. So, I love that there is that discrepancy between that side effect versus something else, right? But versus the virus or the vaccine working, quote unquote, right?
Exactly. And let me just add that over at Housing Works, we have a wonderful chief medical officer, Dr. Vati, who has explained to us also that it seems that the older a person gets, the less of the reactogenicity that you would get from the injection. So which means that you get less symptoms, because I was concerned, as my father is in his 90s and I didn't want him to go through what I went through. But now I'm a little bit more assured by that. So you do have these side effects. They are documented, they are expected, and the vaccines are safe.
So Dr. Arden, really quickly, just to piggyback on that, I know I just recently heard that when you receive your second booster shot or your second dose, that's usually the time when you start to feel some of the effects from the shot. And it's been said that it can be rather hard on people, almost to the point of feeling like you're being sick from heroin. So can you talk a little bit about that real quickly?
Certainly I can. As one who has taken the second shot or the second injection of the Moderna, okay, I can say that I experienced a high fever and I wasn't feeling bad, but I have to say that it's also very time limited, up to maybe 24 hours. And you may feel uncomfortable, but ultimately and it's a sign that your own immune system is responding to the antigen, to the particle that's placed inside you, by the way, that you are reacting to it. You're developing these antibodies. And so this is a sign that the antibodies are developing. It's actually fairly healthy to develop these things. So, it's happening. So the reason, this is new. And so the reason why you would need a booster is to enhance the antibody reaction that you're developing.
Cool.
But I'm still here to talk about it.
Yeah, and when I got my first shot, they warned me that the area which I received the shot would be sore. I've been warned with like that all my life, and I have never felt anything. This one I felt. For about 2 or 3 days, my shoulder was quite sore. The second one, the provider that gave me the shot sent me down and explained that just like the doctor said, that my body's going to respond. It's more of a harsher shot, and don't worry about if I get a slight fever and that. But I felt nothing. Even the soreness wasn't even there like the first shot.
Well, so, look at. I'm sorry. Go ahead, sir. I don't want to interrupt.
Okay, yeah. So what I've learned is it affects different people different ways.
I'm just really curious. I'm sorry. I'm just really curious as to why this isn't something that's talked about more. This is something I found. This is actually something that I found out about from another town hall that I was doing, and there were a number of individuals who were on the call who hadn't heard about that second booster shot and the effects of it either. So I'm just curious, why isn't this something that's put out into the public more?
Why the public isn't discussing this more? Is that what you're saying?
So why isn't it put out to the public? So we hear about everything else, right? Including all of these different antigens that are coming out. Why aren't we hearing about like the effects from a second booster shot, right? And how people will feel the effects of it a lot more. Why isn't that something that's like on the news? Why aren't people hearing about that more?
I don't have an answer for that, but I'm glad that here we are discussing it, and those who are listening can then spread that gospel to others and let them know that second shot of the Moderna may indeed cause them to feel a little bit more discomfort than the first one. But as Mr. Glasgow mentioned, it all really depends on one's body, one's age, because he had apparently no real response from the second one, but the first one, his arm was sore. With me, with my first injection, I wondered if I even received it because I felt nothing. But then I went out running afterwards and did exercise. But then with my second injection, for a day and a half, the night, and the next day, I just was not feeling well, and I had to just wait until that passed.
You want to go ahead?
I want to circle back because I did have a second part to my question. As far as how we can utilize harm reduction to discuss the pros and cons of getting the vaccine. Joanna, I think we had this conversation before, and I think that you had a wonderful response to that too. So I'm gonna kind of call on you to answer this first.
Sure, happy to. So, I think, so let's go back to the basics, right? So what is harm reduction? And it's about allowing the person in front of you to be able to be expert to their own self, right? And paying honor to that. So I think the same conversation applies here as related to vaccination, that as we already discussed, there are individuals who are very eager to immediately gain access to a vaccine. And there are others that are not necessarily running to the vaccine sites. And there are a lot of different reasons for that. As Mr. Glasgow said, there are both extremes in the experience that you're having. So let's talk about what that means. So for us as providers, it gives us an opportunity to do what? Provide information that allows people to make informed decisions in the time in which they're ready. And I think that the point you make, that if the community is not hearing about the second dose and that there may be increased side effects for some individuals to that second dose, then we need to take that information and come back and say, okay, what else can we provide to community? And also understand that when we have those conversations, it's not about trying to scare individuals. It's about, again, giving people the information they need to be prepared, right? And I say that, so if you have the example of the individual who's going to get a second dose, that individual who may have an hourly job may need to consider the timing of their second dose if in fact they have the side effects, so they don't have to call into their job. That's what our role is here, to help people think ahead and be able to plan in a way that it doesn't negatively impact their daily life, right? And the other thing that I want to say as it relates to, how we look at this from a harm reduction perspective is about access. And we know that access has been a huge discussion as it relates to all of the responses in COVID, whether it's just about testing, whether it's about being able to have a mask, whether it's about hand washing, hand sanitizer, all of these things, while yes, lately we see them at almost every place that we go to. But prior to that, we're not free. So we have to think about, how do we provide access to those types of things, the things that we're telling everyone they need to do in order to maintain safety and wellness? Where are we setting up our sites? Are they in neighborhoods and in areas that are accessible to individuals? These are huge conversations that, I think for those of us who have a history of working in harm reduction or in communities, we think about that first. It doesn't always come natural to everyone else. So I say that to say that if we're in facilities or if we're in communities where we see opportunity for there to be increased access, we need to bring that to the table for discussion, because otherwise we may be missing out on individuals simply for the fact that we haven't created the access to testing or vaccination.
Yeah.
Cool.
I wholeheartedly agree with that. Let me just add to what was just said. I think we also need to tap into the gatekeepers in our communities, specifically as people of color. We are, I would say, we are filled with religious folk, and others. When there is a problem in the family or medically or whatever it may be, one of the first people that we may go to are either the priest or the pastor or the rabbi or the imam or whomever it is. And so there's a role for them to play as not only gatekeepers, but people who are, models in the community. I'm in Brooklyn, and I have to say Christian Cultural Center, CCC, which is a large multidimensional church here in Brooklyn. They are vaccinating people. They are vaccinating vaccination site. And I know many who've gone there based, I guess, on the modeling or the influence of the religious leadership there. And they've gotten their vaccinations done. So I think there's a role for those individuals in the community to play to help to, I guess, facilitate access to vaccination.
Cool. So moving right along, I have to speak about something, and it goes towards when this thing first came out, and they started talking about a vaccine. For myself, I was one who wasn't really ready to take the vaccine for many of the reasons that were discussed a little while ago. And I had to stop and think to myself, there are people out here, members of my community, who put all kinds of things in it. We put up all kinds of things in our bodies, and we don't stop for a second in many instances to think about what we're putting in our bodies. You know what I'm saying? And yes, this vaccine was rolled out rather quickly, and when you think about the vaccine, and then you think about other things that you may put in your body that you have no idea about, it's hard for me to come up with a reason for me to say, no, I'm not going to take that vaccine because I don't know what's in it. There was something that I heard somebody say not too long ago during a webinar I was doing around the vaccine. And it's real simple. It's either COVID or the vaccine. You choose. And that kind of brings things into perspective. So my next question is, what do you say to someone who is concerned about getting the vaccine, especially people who use drugs or other substances? How do we get these? We're not here necessarily to change people's minds or to tell people you need to take this vaccine. We want to make sure that we give people, as Joanne said, information so that they can make an informed decision about what to do. How do we have these? Can one of you talk about how do we begin to have these discussions around the need or the reason that they should at least educate themselves so that they can make a smart decision about taking it?
Mm-hmm. You asked a really fair question there. I think one of the things, and this may sound very simple when I say it, I think one of the things that I pay a lot of attention to when I speak with people is about my tone. And I think what's important is that, in providing information to anyone, it's not about challenging the thought process that someone has, but it's about understanding the thought process and then adding what information we know to that. So how we present ourselves and how, I suppose some would say it in some of the cliche words that we use, right? Non-judgmental, if you will. That said, I think it's very interesting. And I have had this conversation with many people about the idea that someone may be a person who uses drugs, yet still is not willing to take Tylenol, right? And I think that there are, like everything else, there are different reasons for that. I also think it's about acknowledging that we know that the use of drugs is the symptom, right? There's something underneath that pushes towards that use, and the use, even for short term, gives someone a relief, if you will. And so I think for some of the individuals I've spoken to, there's a sense of not understanding what is the benefit of me taking this vaccine. And it may be because the individual has not necessarily had a personal experience, whether it be from themselves, their family, their friends. It may be that it is just not a priority in their life at that time. It's very similar to when we talk with individuals or when we talk about social determinants of health, right? So what do we say all the time? We say that if someone does not have a stable, safe home, if someone has no food, going to their medical appointment may not be the priority, regardless of what we may think should come first. And in some ways, I look at it in the same way here. The vaccine for some is a priority based on experience. For others, it may not be.
And just to add just a bit of factual information, as you mentioned, Mr. Suarez, in terms of the rapidity of the development of this vaccine. Quite frankly, scientists had information about the about the structure, the genome, and the life cycle of this type of virus for over 10 years. So this really wasn't anything new. People have been working on this for a very long time. And then there was worldwide sharing of this information, so that now we're in 2021, we're in the 21st century. People were able to really share this information very quickly and share the developments very quickly, so that advancement could be made, not even on a national level, but on a worldwide level. So I think all of that contributed to how quickly something like this came along. But the data for this has been there, just lying there for decades.
Excellent.
As a harm reductionist, when I speak to people, I let them know, first of all, their thoughts are valid, okay? Whatever their thoughts are, okay? My job is to educate them to the best of my ability. And when talking to them, it's all about engagement. People don't really buy the theories all the time, they buy you, okay? So if you always been honest with them, you always told them the truth, they tend to listen to you a little more. I got this old saying, people don't really care what you know until they know that you care. So all that, we can give them data, but sometimes that's going right over their head. They ain't paying no attention to that. And, when some of us was out there, people come to us with advice, we will always say, well, what would you do? And you have to answer that honestly. You know what I mean? Give them all the information and be very honest with them and back them up for whatever decision they make. And whatever decision they make, let's find the healthiest way to do whatever they decided to do. And that's my job.
Excellent.
I love that. I think that that's, such an important part, as like you said, coming from this harm reduction approach, right? And as a harm reductionist, like this is really what we do. And I think having that respect for all individuals, regardless of whatever, choice they want to make, having that respect and having that support, amazing. So thank you all so much for those answers, because they're really important. So I guess moving into my next question, this is kind of about, barriers and access. So again, I'm going to kind of point this to Joanne. I apologize. I promise I'm not targeting you. We're moving into this next wave of criteria and openings for people to access this vaccine, and there's been some speculation regarding the required proof of eligibility for the vaccination. So could you talk a little bit about that process, so that everyone's just more informed coming into their vaccination appointment with what they need, and any tips or helpful hints that they can be prepared for, and what to expect?
Sure, absolutely. So as everyone knows, there have been phases as far as eligibility, phase 1A, 1B, and most recently on the 14th, the Am I Eligible portal open to individuals who have comorbidities and are immunocompromised. So what does that mean? It means that on the 14th, the appointments became available to start scheduling, anticipated for the 15th. A number of appointments were released in an effort to try to accommodate, recognizing that up until now, we have not had enough vaccine for all of the individuals who are eligible, not unique to New York, the reality of where we are. So in the Am I Eligible application, which is an online eligibility application to determine your ability to register for an appointment, are a series of questions, and I see, thank you, Lila, for putting up the the link. It helps to have teamwork on here. And then there are a series of questions to determine eligibility as well as to register for the appointment. There are 2 points of assessment, self-assessment, and that allows you to attestation. That allows you to attest for yourself on what criteria you're eligible for. When you go to your scheduled appointment, you want to bring a copy of that attestation as evidence of a comorbidity or being immunocompromised. That is what you need in order to be able to go through the registration process on site and be vaccinated. Now, there are other eligibility criteria, certainly individuals who are over 65, individuals, and there's a whole host of lists, and we can share that link as well to show you who's eligible in 1A and 1B. You need to show eligibility if you're coming due to employment. There are particular employment titles that are eligible. And so you bring either your ID from your job or a letter from your employer. And any of the other eligibility would indicate in that link there exactly what you would need to bring. But I want to be really clear about for individuals who have comorbidities or immunocompromised, because I know that there are other options on there as far as needing either a physician's note, some other form of documented evidence of your diagnosis, or a county may have other tools that they're willing to accept. I also want to underscore that I'm speaking about the state vaccination sites. So the state vaccination sites will accept your attestation without needing any of those other documents. If you're being vaccinated in another location, you want to be really clear about what it is they're asking you to bring in order to get through to your appointment.
Great, thank you so much. And I guess for individuals that, you know, another kind of off of that question, Riley, I'm not sure if you've experienced any individuals having any barriers as far as, you know, getting their vaccine because they didn't have, you know, proof of documentation or anything like that. Dr. Artie, if you've heard any barriers that documentation has been, you know, a barrier to receive the vaccine.
Tell you the truth, this was one of my first concerns, but I witnessed while I was getting the vaccine, you know, after you get the vaccine, they make you stay there for 15 minutes to make sure you had no adverse effects. I've seen people come in and, you know, you can tell a lot of people right off the bat. And they jobbing with the guy, show him no paperwork, and people are very lenient. And they got the vaccine, and to be truthful, they never asked me for mine. So I was shocked, but I believe that depends on your gatekeeper. You know what I mean? Sometimes you get lucky, then you got some people want to, you know, what blood type you got. You know what I mean? So some people just gonna give you the vaccine, and the fact once they start giving the vaccine and people missing appointments, and then they start looking for people, it got a little more acceptable that you might not have all your paperwork. That's just my view for what I've seen.
And I have not seen nor heard of people being turned away. I can't say that I've seen that personally, but I have heard certainly conversations about the need for proof, documentation, and so forth, which quite frankly, when I first heard and read about it, just really took me back for something that is so life-saving. But I haven't seen that directly.
Yeah, when I first heard it, it sounded like, you know, voter ID, you know, the voter
Yeah.
gotta have this ID, that ID, and I was like, okay, this is some way they suppressing things. But
Right.
when I got there, I did not see any symptoms of that, though. I could have just been lucky. Time and place.
So I want to acknowledge something up front, and I see that there's a reference to this in the chat. I do know that certainly there have been conversations and concerns expressed about for individuals who do not have ID. Or, prior to, for example, for individuals comorbidities or immunocompromised, what if the individual did not have a medical doctor? So, these are very appropriate concerns to have. I think the conversation about not having ID is one that continues to actively be discussed because we recognize that, across New York State, we certainly have seen in the recent years very progressive action taken for individuals who remain undocumented. And so as we look towards vaccination and continued COVID response, we have to take into consideration what the needs of these communities may be. So there's more to come on that. I just want to acknowledge it up front. It's real. And, even for individuals who aren't undocumented, who may not have ID, individuals who are, who are homeless at the moment or whatever their circumstance may be, we have to continue to figure that one out.
I heard of one case where somebody worked in a hospital, but at the present time they was laid off or something. So that was a gray area, but they still gave him the shot, but he was laid off, but he worked for the hospital, just not at that moment.
Mm-hmm.
So, yeah.
Mm-hmm.
So can anybody raise their hands who has taken the vaccine? Has anybody taken the vaccine? Everyone else? No, Joanne?
I haven't taken the vaccine. I actually became eligible this week with the addition of individuals who are immunocompromised or have comorbidities. So my time has arrived.
Good deal. So just to be clear, I took the vaccine yesterday. Yeah. And I got a text message from a friend of mine who took it with me, who actually encouraged me to take it with them and asked how was I feeling? Am I all right? And I started getting a little nervous, like, should I be expecting something to happen now? I take this damn thing, but everything is still good. I haven't grown any wings. This next question is going to go to Dr. Artie. This is from the audience. So, Dr. Artie, can you talk a little bit about the history of the virus jumping from animal to human, and given misinformation, importance to discuss the origin?
It's a very, very interesting and challenging question. And yeah. I'd love to hear an answer to it, or whoever would know an answer to it. I mean, clearly there are mutations that have to do with viruses. There are viruses that live amongst animals. There are viruses that live among human beings. But as far as the origin of this, quite frankly, I don't think anybody really knows. There are many, how can I say, I would say myths, conspiracy theories having to do with maybe was it in a lab? We don't know. What I can say is that viruses do mutate, that this is not new. This is a pandemic. We've had a pandemic approximately over 100 years ago, which unfortunately killed many folks living throughout the world. And so I don't know what the next 100 years will be, but we shouldn't be surprised now that we are documenting these things, that occasionally there are mutations in the viral world that may, just affect folks. And thankfully this time around, we can gather our resources and come up with a vaccine that can combat it. But this is not a surprise. And as far as where it's coming from, or your guess, anyone's guess is as good as mine. And the mutations are what is causing these variants that we're hearing about now. Mutations. It's a natural evolution, I would say, of that's take place in the viral world. That's as best the response I can give you.
Thank you.
I'm going gonna, before I go back to the chat, I'll give everybody, a couple more minutes and encourage you all to submit your questions in the Q&A so that we can have, again, this kind of semblance of normalcy where we can be together and communicate. So please, feel free, drop your questions in the Q&A box. But for the last question that I have for all the panelists is, do you all have any final thoughts? Or is there any, really big takeaways that you want people to walk away with after this, town hall session?
So I'll jump in. First of all, I want to say thank you. Thank you for hosting the opportunity for individuals to pose questions and for us to talk about the experiences that we've had. So thank you. I think the takeaway is the continued work that all of you are doing, and that recognizing whether we're talking about COVID or anything else, that the philosophies and the values in which the harm reductionists do their work and engage with community and care for community is what's key in this subject and in this conversation. I think that COVID has proven, as we've seen many times before, so many things within our social fabric, the level of stigma and discrimination, and the conversations related to access and the disproportionate impact that COVID has shown to have on Black and Brown communities. What it teaches us is that, here we are once again, and we need to take this next lesson and realize that we have to work across public health and focus our priorities and our resources and our energies on addressing social determinants of health, and recognizing that the general health and wellness of our communities is only going to improve and get to a place where we can all feel safe and supported and stable when we seriously make changes to how we respond to the needs of the people that we care for. So I say that to say, I think everyone that's joined this conversation, certainly I realize your life work is prioritized around that. And my messaging is for all others who need to come to the table and find a space that will allow us to really, this is once again another example where we have opportunity to impact change.
I would like to piggyback on that and thank everybody, all harm reductionists, because when COVID first hit, people had to stop us from working. We just kept, regardless to how it affected us, or we thought how it would affect us, we might have stopped in the office thing, but we make sure syringe exchange was still open, still working. We went out and still did outreach, because one of my coworkers said something like, how can we take a day off, but the people that out there need us, they don't take a day off. Mm-hmm. So I think that I'm in the right field. People really care about people.
Yeah.
So
yeah.
I think it's important to continue to provide this kind of appropriate education to our community, because to think in terms of Afro-American history and all that has ravaged us as a people, Black and Brown communities, and then when something like this presents itself as an opportunity to improve the health of the community, in light of all of the, as Joanne, you mentioned the social determinants of health, and consider all the comorbidities that are in our community due to poor nutrition, due to a host of things having to do with everything from asthma to diabetes to all sorts of things. It's a shame. It would be a shame if we do not spread this gospel and help people make intelligent choices. And not to say that if they say no, fine, then as as Mr. Glasgow mentioned, we support whatever decision it is. But but for our people not to have the knowledge to make an appropriate or intelligent decision, whatever it may be, would be just such a shame. And I have a quotation here from Martin Luther King. He says, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. So this is something that's killing people worldwide. We have to take advantage of it, and we have to let our folks know this is available. So whatever it may be, whatever documents you may need to present, wherever you may need to go, by all means do so, because from what I'm hearing from the news, other communities are coming in and taking advantage of what is being made available. So by all means, let's just do what we have to do for our own."
Yeah, really quickly, just going back to a question I posed a little while ago, thinking about whether or not I should take the vaccine, all I could think of as I continued to ponder the question over and over was, it would really be sad and it would really be a shame if after all this time of waiting, we now have a vaccine and suddenly I should come down with COVID and be one of those who are lying in an ICU on a respirator. But how would I feel? Thinking back, if I took the vaccine, would I be lying here right now? And it was an easy choice after just that simple thought. It was an easy choice for me. I want to go back to the chat box. This question is from Charmaine. Is there any medical issues that would disqualify an individual from taking the vaccine?
I can take a stab at that. I would think that if you're symptomatic now of any type of anything that would cause you to even, that would cause your body not to be able to meet the challenge of the vaccine. For example, if you are presently suffering symptomatically from COVID, then that would be something that you'd want to reconsider or consult with your physician about that. But based on the last criteria that were sent out from February 15th, it seems that the gates are open to a lot of individuals who have coexisting disorders to take the vaccine. Mm-hmm. But I would say speak with your primary care physician.
Mm-hmm. And so what I would say is that for anyone who has very significant allergies and a history of allergic reaction, that individual may also not be eligible. When you go to the Am I eligible, there are a series of questions that are asked about your medical history. So what happens is that in addition to the eligibility, there's an initial assessment as far as your medical history, so that when you arrive on the site, there is the opportunity to meet with another medical evaluator to determine at that time, based on what you've reported and how you present that day, whether or not you're eligible to get the vaccination. The reason why the medical evaluation occurs again on site, even though you've offered the information, is because a lot of times people are scheduling their appointments weeks out. And so in those weeks, anything could change. And so for that reason, there's a medical evaluation. It also is a reason, and I know this was mentioned before, why after your vaccination, you are asked to remain in the facility for 15 to 30 minutes. Individuals who don't have a significant medical history or any issue on that day that would cause one to want to evaluate further are there for 15 minutes. You can be up to 30 minutes depending on your medical history, and if it's determined that additional time should be taken to ensure you're not experiencing any type of adverse effect.
Great, thank you all so much for answering that question. Another question in the chat box is from Amy Cruz. I've been hearing different things about taking OTC medications with the vaccine, like not to take Tylenol before the shot itself. Is this true or false? And then there's also a part 2 to this question. Also, can you take OTC medication to reduce the side effects before or after, so people who cannot take time off from work can comfortably get through the workday?
Anyone want to take that?
Take it.
Joanne, I was waiting for you.
Yeah. Okay. So what I can say is that, yes, certainly there's been a lot of conversation about over-the-counter medications or the OTC that's being referenced. It is said that prior to the vaccination, not to take any of the over-the-counter medicines. That said, for those who are experiencing symptoms after the fact, as described earlier, certainly people have been taking over-the-counter medication in order to help reduce a fever, and or if anybody has any, any types of aches or pains. So I think that what my recommendation would be is, because I am not a clinician by any means, that rather than take that advice, whether it's from me or anyone else, that it's a conversation to have with your medical provider prior to and or when you arrive on site to speak with a medical evaluator.
Yeah, the issue is that potentially the OTCs, Tylenols, and so your body's trying to mount this kind of fever as a response and building up the antibodies, and so you don't want to do anything to discourage that. That's the issue. But I have to say, I had 104 fever, and yes, I took Tylenol because it was pretty high. So I don't want to be dumb about it. I want to treat what I have to treat. If your body's to the point where you can't even move, you want to do something to help yourself. But in general, that is what I have read in terms of the OTCs potentially preventing or interfering with your immune response, because the fever is just a sign of your body just building up defense against what ails you.
Cool. Going back to the chat, we have a question from Hiawatha. Are Black and brown communities given the same vaccine as other communities? Valid question.
Yes. So the answer is yes. So what you see right now is that the two different vaccines are called from Pfizer or Moderna. If you're following the media, you know that Johnson & Johnson is very close to having an additional vaccine. I think the things that people pay attention to as it relates to the differences in vaccine is the percent of effectiveness as determined through their clinical trials. Also, one of the things about the vaccine is how it's handled, how it's managed and stored, which is really significant. We're learning that with Pfizer, which takes some exceptional steps as far as the storage. But the answer is yes, all individuals are receiving the same vaccine. Again, recognizing that there are different vaccines by name and also by content.
Great, thank you for that answer. So this one is from Hiawatha again. How can you make an informed decision with the lack of factual information? Sure.
So, I guess that I don't know exactly, and trying to understand the question. So I'm going to take it from this perspective. Perhaps the suggestion of not having factual information is because the vaccine is so new, right? And so a lot of times what you'll hear when people talk about the vaccines, they'll say, well, we don't know that yet. So the truth of the matter is there are many things we don't know yet. We don't know how long the vaccine will last. We don't know when boosters will be needed. We're still learning based on people's experiences, the differences of side effects. When you hear our colleagues speak about the side effects, they're speaking and referencing what we most commonly hear, right? In addition to their own personal experience. And so I think that's why, as we continue to move forward, we have to make sure that we take from these experiences and we speak about them candidly. I think it's really important, and I'm really grateful to all of our colleagues who chose to speak about their personal experiences taking the vaccine, because that's how I learn. My experience may not be the same, but at the same time, it'll at least allow me to think forward as to what I might need in order to, after the vaccine is given. So we do have a lot to learn as we continue to move forward. I think what we can say is so far from what we've seen, the vaccine has, as far as the administration of the vaccine, has proven to be effective, and the side effects have been fairly consistent. And the steps that have been taken, while for some seem maybe a little bit extraordinary, you know, because when you go and get a flu vaccine, you go to the pharmacy, you get a flu vaccine, you head home, right? And this is a little bit different because we have the monitoring and things like that. But I think all of that is because we want to learn and understand more. And in the process of learning, we want to ensure that we try to maintain people's health and wellness as best that we can.
Just to add to that statement, like Hiawatha said, not having all the facts, there's so much disinformation out there too. Just like anything that you look at on social media, you need to research. You have to really research, because you have people, I've read things where people said the doctor got vaccinated and 2 weeks later he died. And then I had to research and it wasn't a true story. You know what I mean? There's so much disinformation out there. Actually, it's too much. So how do you know you're reading something that's truly factual or non-factual?
That's true. That's true. Which also goes back to speaking with your provider or trusted advisor, right?
Trusted advisor. That's that key word. People that you trust, because some people are speaking on their ignorance.
Very true. I do want to note that Lila Hunt did post the FAQ, the frequently asked questions document, that for the information we do have can help to advise and inform related to COVID vaccine.
And I think too, just to comment on that, I think, you know, really, unfortunately, having some patience and grace throughout this process too, because I think there's a difference between like misinformation and learned information too, right? So I think it's understanding that, you know, it's a novel coronavirus, you know, so it's new. We're in this new thing, and I think understanding that we're all doing, you know, the best that we can, and really, you know, latching on to, like, you know, like what was previously said, to your trusted advisors, to you know, the CDC, to you know, New York State Department of Health, you know, all of these trusted kind of sources that you're getting this information. But understanding that when we do come out with new information, or when there is new information provided, to really take a step back, because it's so easy to go down the rabbit hole of being frustrated and just, you know, smashing things, and you know, that's not really good for anyone's mental health, you know, ever. So you know, really just taking a step back, taking a breath, you know, and going to those trusted advisors, going to those resources, and making the decision for you. And unfortunately, you know, that's really hard for a lot of people to, you know, adulting is awful, I have to say. I really don't like adulting.
It's the process.
It is. And that's the thing, is just, you know, understanding that this is your decision, this is your choice, getting, you know, as much information as you can, deciphering it from a really great source, and then empower yourself. This is your life, this is your health. Do it.
Yep.
Sorry, went off on my tangent there. We have one more question in the box, and it's from William Robertson. So please, if y'all have any questions, we still have more time. You know, feel free to you know, get those answers in, or get those questions in. So this question is, I've been hearing that you have to have an email or phone number to get tested, which affects the marginalized community. Does this also apply for the vaccine, because there's a lot of people in said community that don't have?
So yes, on the Am I Eligible, it does look for an email and or a phone number in order to receive texts, because that's how you're able to get the, for example, the attestation to bring, and or receive updates as it relates to your scheduled appointment. What I will say is that, you know, there are multiple places now. We're continuing to grow in a number of areas to be, or places that one can be vaccinated. So, you know, again, when I speak about the MI eligible, I'm speaking about state vaccination sites. As community-based sites, or as some call them, the pop-up sites, don't necessarily have these same parameters and may be more accessible for individuals. Again, this is one of the areas that does come up, and we're talking about, you know, what the other options are, recognizing that not everybody has access to this or knows how to utilize, you know, email or these fancy phones that we have that I don't even know how to use all the buttons on. So it's a fair question, but I also want to make a point that the community sites are not necessarily asking for that same requisite.
Cool. I want to just really quickly go back to, oh wait, no, we have another question in the chat. Cool, this is from Elizabeth. Have there been tests or studies done with people who use opiates, benzoids, meth, etc. in the vaccine?
Not that I'm aware of. I don't know. That there certainly could be. I'm just not aware of it at this time.
Yeah, I haven't read anything about that. I think people were placed in terms of their comorbidities, but not in terms of substance use. I haven't read that, if there was.
Cool.
I kind of wonder what's behind that question.
Yeah.
Sure.
Yeah. Do you want to just run here? Or just run from Hiawatha?
Go ahead.
Hiya's burning it up. Go ahead, Hiya. Hiya asks, will these vaccines affect someone who is undetectable or virtually, what's this? Suppressed.
Virally suppressed. Yeah.
Right, virally suppressed, my bad, virally suppressed.
No, so I'm assuming that we're talking about individuals who are diagnosed with HIV and virally suppressed. No, there should be no impact from the vaccine to one's status. No.
Good deal. You know, a question that I did have is, when receiving the second dose, and you said that you've gone through it, Dr. Artie, is there anything over the counter that individuals can take to help with easing that effect from the second dose?
Well, there's a lot that you can take, but should you take? That's the question. As I mentioned before, because of my fever that was so very high, I was perspiring a lot. I did take Tylenol, but I have read and heard that it may be something that may have, you know, or that could potentially just kind of hold back my immune response a bit. So I think it's going to come down to what the person is experiencing. What are, you know, how uncomfortable are they? You know, I certainly would not want somebody to, you know, have a fever to the point where, you know, their electrolyte becomes imbalanced. And so I think people will have to make decisions based on what they're experiencing. But what helped me a lot also was I drank a lot of water. I was perspiring a lot, and for me that helped. That helped reduce, I think, in some ways, the fever. So it depends on how uncomfortable somebody is. How badly, you know, is your body hurting? Do you really need relief? It's something that we go through, but you know, I don't think it should be something to the point where you're being tortured to death. You know, so it depends on how uncomfortable I would say someone becomes. Not to the point of, you know, you needing to go to the hospital. You don't want that. So then you do what you need to do.
Sorry.
Yeah.
There is off of that though. There's a question in the chat from Elizabeth Pittman. I was just wondering if any studies showed effects on the efficacy of the vaccine or side effects with people who use other drugs or medications. So like would taking other drugs, or how I'm understanding the question is, you know, would taking other drugs, you know, diminish the efficacy of the vaccine at all?
There are some thoughts having to do with a preference towards, let's say, a Motrin as opposed to a Tylenol. There are conversations having to do with that. Do we know definitely for sure? I don't know if there's a definitive answer out there, but that's one recommendation that I have come upon.
Agreed.
And me, I took the Tylenol, so there, I was bad.
But no,
See you now.
All right.
Great.
Thanks.
All right. Are there any final questions? Any thoughts at all? I'm just going to wait a couple seconds because I think I see Hiawatha began a question.
Yeah.
There we go. So Hiawatha is asking, why wasn't many of the communities we serve and work with a part of any studies? I think that's a great question. I think so. I was diagnosed with COVID relatively early in March, and I felt a lot of March of 2019, and I felt a lot of frustration with regards to I felt the lack of studies and the lack of like why are people doing this and why aren't people doing this? And
Can you say that date again?
Yeah,
You said March of 2019.
March 2020. Sorry.
Oh.
That would be something. If I got it.
Have another session
Covering what I had. Yeah, that's great. Yeah, no, March of 2020. I felt really frustrated because, and again, it's really easy to do. But I think those are great suggestions. I really do. I think that everyone here, and I don't want to speak for the panelists, but I have a feeling that I'm safe to say this. I wish that there were more studies done. I wish that there were targeting, these marginalized communities. I want there to be more information, and I want it to be last year. But unfortunately, this is still so new, and any data that's collected, I mean, you're talking about less than a year old or just a year old, and that's really new when we talk about just viruses and things. And again, I apologize, I'm not a doctor, so I don't mean to speak out of turn, but I think that that's a really good point. I really want there to be studies. I know Upstate here in Syracuse has done really great research on the long-term effects, but I think that there's just a lot to this. And I don't mean to make excuses or justifications for this, but I think that that's a great point. I think we should. But not to my knowledge, I don't know of any, particular studies that are really collecting that data.
Mm-hmm.
I don't know if anybody else wants to speak on that too.
Let me just say that when the studies were coming out in the various phases, there was an effort being made to get communities of color, volunteers from that community, and a lot of the distrust presented itself because people were reluctant to participate in these. And they were actually experiments. There was a lot of efforts to try to get folks from our communities to participate. It wasn't easy, but distrust had much to do with it. But I do have some statistics in terms of both the Pfizer and the Moderna vaccine in terms of the racial and ethnic distribution. There were at least, I would say, 13 to 20% Hispanic representation in these studies, 10% on both the Moderna and the Pfizer, African Americans, 6% Asian for Pfizer, 4% for Moderna, and all others were like Native American, 1.3%. So I have to say that in both studies, in both of these vaccines that came out, there was some representation. Could it have been more? Should it have been more? We can always debate that, but it goes back to the distrust that is in our community pertaining to these. Thankfully, there were some representation, and now you have, myself, I think Mr. Glasgow, we are two individuals who've, Suarez, I think you had mentioned yourself, who've taken or will take it, and we'll let you know how we do.
But I think that the conversation of research and clinical trials, particularly in communities of color, is one that's a long-standing conversation, right?
Yeah.
The availability, the availability to participate, the willingness to participate, and the realization that when we see research and people talk about clinical trials, it's really important to look at the details of that to understand, are you represented? And if not, then what does that mean as you consider, whether we're talking about vaccine or anything else. I noticed in the chat that there was a question related or a comment related to individuals diagnosed with HIV, and if there's information there. What I put in there was a link to our HIV clinical guidelines medical criteria committee that did issue a statement indicating that the committee made up of experts in the field of HIV and physicians, clinical providers, that they did feel that it was important for people diagnosed with HIV to consider taking the vaccine. There was also a research article that is a small study that was done here with the New York State Department of Health AIDS Institute, along with the School of Public Health, that looked at the impact of COVID on individuals who are diagnosed. And what we recognize in that small study is that the mortality was higher among individuals diagnosed with HIV who acquired COVID and were hospitalized. So with that study, along with other evidence, that's where the criteria committee felt that they were in a place to make recommendation on that vaccine. So again, when we go back to trusted advisors and we talk about factual information, I would suggest these are the places, individuals who are part of our communities and long-term members of our communities, not individuals simply doing research for the sake of accomplishing the research, but doing research with the intent of helping to inform communities and continuing to build on what we learned.
Awesome. So where are we? We're in a pandemic. Are there any other questions in the chat? Do I see anything?
Hiawatha has one.
Of course. Burn it up, Hyatt. Burn it up.
You want me to read it?
Yeah.
Hiawatha asks, what does it mean if we're not included where we thought about, and was it meant for us? Not being a person who does clinical trials, I don't know all what goes into the selection of who participates in the trials. I don't know if it's based on information already known and trying to fill in areas where there are identified gaps. But what I will say is that, I think that in particular, as we talk about the COVID vaccine, it was looking at the opportunity to try to, even on perhaps a smaller scale than usual in a clinical trial, look at a broad group of individuals to see what were some of the themes and consistent, whether it be side effects and or other areas to be learned from. What does it mean? I think it means a few things in a broader conversation. I think it goes back to my comment about clinical trials and research oftentimes not being accessible or available within communities of color, and us continuing to find the opportunities to leverage and use our voices to ensure that Black and brown people are part of clinical trials. It means making sure clinical trials come out in a way in which people can understand what it is that's being asked of them and what it is, what are the potential impacts to being part of a clinical trial. Being part of a clinical trial takes a lot of thought and consideration. And again, I point back to the conversations that need to be had with trusted advisors. So as it relates to these particular clinical trials, there may be others who can comment even more so. But I do think that if we're in positions to read about the trials and how we get to the places we get with these advents of tools such as a COVID vaccine, always take advantage of that opportunity.
Awesome.
Yeah, I love that. And you know, and that continued advocacy, you know, what we were talking about earlier is like continuing to, you know, talk with people who are doing the studies and really pushing and advocating, you know, for communities of colors and their involvement, and taking a look at the why. I think that that's really important, and I think that it's a great question. So thank you so much, Hiawatha, for asking those questions. You know, they're really very important, and it's a great conversation to have. I don't believe that I see any more questions. So, thank you all so much. Thank you to the panelists for joining us tonight. It was wonderful. It was such a great opportunity to talk with everyone. Thank you all for, sharing your insights, asking questions, being a part of the community, again, virtual community. So thank you so much for everyone. And please, I really would love to encourage everyone to reach out to NYSHRA with any questions, either through our website, www.nyshra.org, or emailing. The email is, I'm going to just put it right in the chat so that that's easier for everyone, but please, reach out. And thank you all so much for coming.
Thank you.
My
Exactly.
pleasure.
So just piggybacking on that, from all of us here at the New York State Harm Reduction Association, in association with Housing Works, and to all of you around the country and around the world, I'm Robert Suarez, thanking you for your time this time. Till next time, stay safe, everyone.
Thank you.
Thank you.
Good night.
Bye, everyone.